there's a number of reasons why local public health campaigns fail. And often it is lack of data or lack of adequate measurement and evaluation. There's no shame in this. There's a bit of a knowledge gap with some of us. Online digital advertising is a fastly moving place. It's hard to keep on top of it. We've all got day jobs and other priorities from our organisations. So sometimes the knowledge gap plays into it. Sometimes we choose the wrong channels. Sometimes the messaging isn't great, or the messaging isn't informed by behavioural science, which is my passion. Bad choice architecture, where we take people, maybe not having clear calls to actions or too many calls to action. We're contacted by some unscrupulous and convincing salespeople who convince us to put our money into places where there's very little evidence that they will work. And I've witnessed it. That they are really convincing. So I think always question those approaches and ask for the evidence. There's an element of doing what we've always done, and there's always pressure from others, members, councillors, leaders, to kind of be visible. And everybody likes to see stuff on bus stops or whatever. But where's the evidence that this works? Another thing that often contributes to campaigns not quite achieving the impact they had, and I've mentioned this already, but seen it so many times with so many case studies, that you come up with, people may invest in research and insight. They might really kind of get their head around the problem or the problem behaviour that they're trying to change. And they may develop something really creative. They might develop, some really good messaging that resonates with their target audience, that maybe, if we're talking digital, drives them to some action, which is to click on that advert. And then what happens is they take them to a landing page, which is, on our corporate websites, which aren't always the best. They can be quite sterile. They can be very corporate. And people get hit with, 20 choices, or the calls to action don't really jump off the page. And, as a result of that, the campaigns fail. And I've seen that time and time again, really good campaigns that take people to a place that, just doesn't inspire any action at all. And it's, and I guess often you get feedback from those campaigns, and you'll get hit with lots of big numbers about the people you reached and the people who clicked on and what have you, but ultimately it is all about the action that people do take. So the place that you take them, and that information choice architecture is really important, and keeping that as simple as possible.
When people are doing this, we can place search advertising against those results. As you can see here, there's an ad for Richmond and Wandsworth's free health check. Now, if I click on that ad and I go to the landing page, the richmond.gov.uk page, it may be that there aren't the right pixels on that site to detect and tell Google whether I landed and whether I went on to do something else. And the most important thing here is that conversion. So when I sign up for the health check, we need to trigger a conversion pixel which tells Google, well done. I don't equate this to sort of evil robots. I equate it much more to an enthusiastic golden retriever puppy, right? You're giving it a biscuit every time it does something, and it will then repeat that behavior and do it faster and all the time. And that's what we're trying to do with these platforms. So having the tech in place on a landing page means we can tell Google how to do its job better and how to guide it to do its job better. So it's one of these wonderful feedback loops. Couple of points. Some of these platforms will actually reduce your cost per click if this technology is in place. And so that means more outcomes. You unleash machine learning to optimize your campaign for you. And so your cost per outcome goes down over time. And you can also demonstrate that happening. I'll just skip back a few slides. That graph is orange is outcomes and blue line is interactions. And so we're able to reduce interactions per outcome over time. So often in campaigns, a lot of the budget and resource goes into paid channels that kind of we know aren't really generating that much in terms of interactions and outcomes. If we're not measuring, we don't have that measurable place, we can't prove that. And then often a lot of the heavy lifting is done by digital channels with a small proportion of the budget, and that delivers most of the outcomes. And where we can move if we have these landing pages in place is towards this situation where we reduce investment in stuff that we know doesn't work and increase investment in the stuff that does. And what does that mean? That means more outcomes for your budget. That means more proof of impact. That means more return on investment, which means communications becomes more investable. So thinking about that, just that ad tech, that plumbing side of things, when you and us work together, we help remove all of those barriers. You can then see what's going on, and a conservative estimate of campaign performance, we can times it by 10.
I'm probably going to talk a bit about the detail of some of the campaigns that we've been running at Cannes. The one that I'm going to feature is around smoking cessation, which is what Russell's just mentioned. We're running it for Coventry Council and Warwickshire City Council using platforms like Meta, Snapchat, YouTube and Google Search. When we started running the campaign initially, it's been running since September, we discovered that the landing page didn't really, a bit what Russell said earlier, is that it had a lot of information on it. And I think what made it a difficult situation for us was that there were two boroughs on the page, and there was two types of signposting. So there was different numbers, different form filling. So what we decided to do was suggest a landing page, which they agreed to, and it was, again, use their branding, but we made the landing page very, very simple, a few questions, and then it's straight to a submission, which made life a lot easier for them. We wanted to do better, so what we decided to do was run some in-platform lead gen forms in Meta and Snapchat. And we want to experiment to see if that would work. This is something that we've been doing in foster care recruitment, and it's been one of those things where you don't need to click away from a separate web page. You're still within the realms of the platform, and you're not having to do that extra click, which made a massive impact. As we went through it, what we realised also was the contact information, because you're already in the platform's already got your information, so it auto-completed all the data, which made it even quicker. And then obviously everybody's a bit worried about it being ethical, from what Russell was saying earlier. There's a data privacy covered in there referencing both Meta and council policies. All submissions are received by the council team, and can continue to offer support to them. We did a very similar thing with a lead gen form within Snapchat. Again, running the video, again, a few more questions, and through to submission. And we discovered, by experimenting with some of this stuff, we realised that actually submissions were going up, and Facebook proved to be really, really good. To our amazement, from the 6th of January, which is when we started, we've had over 167 lead gens specifically just from Meta. Snapchat didn't work as well, but Meta really, really, really was the one for us. In my mind, it sort of demonstrated that there was a desire and a need for people wanting to quit smoking, but they just needed that little nudge.